Hi, I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today we're going to be talking about treatment options for PMDD. What are the most evidence-based treatments?
So the gold standard, meaning the one that you should try first, that has the most evidence and that's considered kind of the safest, is SSRIs.
Right, so I think there are 3 approved by the FDA for PMDD.
Well, I mean, we should tell you what SSRI stands for.
Oh, yes.
So it's selective serotonin reuptake inhibitors. They're a specific type of antidepressant, anti-anxiety medications that act on the serotonin receptors in your brain. Well, in your body, but in your brain is where they do that action to help with PMDD.
This is like the class of medication you know about, right? Like sertraline or Zoloft. There's Lexapro, which is escitalopram, Celexa, which is citalopram. I mean, like, these are the class of medications that like a lot of people are aware of, I think. So those are the most evidence-based ones. So sertraline, fluoxetine, and paroxetine are the 3 approved by the FDA.
Yeah, those are FDA approved for the treatment of PMDD. But also there's research looking at escitalopram, Lexapro, and citalopram or Celexa, and then just the SSRI class in general. There's 2 different ways you can take those medications when you're doing treatment for PMDD. So for some people, they just take them during the luteal phase of their menstrual cycle, meaning from the time of ovulation to the first day of their next menstrual cycle. So those last 14 days. That's when your hormones are changing the most, and that's when people typically have symptoms of PMDD, but that doesn't tend to work for everyone, and so there's taking it continuously, then that might be a little bit more helpful, but you could try, starting off with the 14-day each month one, and then switching to the continuous if that doesn't work.
I've also had a few people who have it continuous and then like a slightly increased dose during their luteal phase, like right before their period, if they're noticing that like most of the time I'm fine, and then I have this specific set of days where it's like I'm not okay. So I've done that too. Yeah. Okay, so what would be another treatment option? So
the next treatment option, if SSRIs don't work or you can't take them for some reason, is drospirenone with ethinyl estradiol.
I think it's like very specific amounts, which was like the generic version of Yaz.
Yeah.
Right?
And taking it either continuously, where you don't take the little sugar placebo pills, or taking those 4 sugar placebo pills, either one. Technically, the FDA approved one for PMDD is taking the sugar pills.
So we want to try those, and my preference is that we try those plus therapy before we move on to anything else.
Yeah. Therapy definitely has evidence around being helpful for PMDD and shouldn't be left out of treatment, in our opinion.
Right, of course. So if we've tried those things and they're ineffective or they're only partially effective, next step would be using more hormone-y kind of things.
More anti-hormone.
Anti-hormones, yes.
Basically, GnRH analogs.
Yes.
Which there's 2 that have evidence in treating PMDD. One is Leuprolide, 3.75 milligrams, and one is Goserelin, which I never know if I'm pronouncing that right. 3.6 milligrams. Basically what these medications do is they completely shut down your hormones. They shut down your ovaries, so they're no longer creating any hormones. And this can be helpful obviously in PMDD because you're not having that hormonal shift anymore, but it's also very high risk because basically you're putting yourself in early menopause. So that's why we kind of want to save it for last resort. And for some people, if that's not working, it's probably not PMDD, or might be some other underlying mental health disorder.
Mm-hmm. So there's an option to kind of like shut things down with those analogs and then add back in hormones so that you get the benefit of those hormones on your overall health, right? Like your cardiovascular health, your bone health, your brain health, other forms of.
Right. Yeah. So what will typically be done is you'll take these medications for a few months until all your hormones are shut down, you're feeling better, and then they'll add back in small amounts of estrogen and progesterone at a continuous amount so that you're still getting the benefits of estrogen and progesterone, but they're not changing throughout the month, and that change in hormones is what creates the symptoms of PMDD.
Mm-hmm. Right. Okay, so if that's effective, basically you can create that same thing surgically with an ovary removal, call it oophorectomy.
Yeah, just get your ovaries removed.
Yeah, it's basically the same thing. So we would save that as like last resort. Really.
Yeah, because once you remove your ovaries, you're putting yourself in menopause. So, all the symptoms that come with menopause, and you can't have babies anymore. Well, the natural way.
Yeah, I mean, maybe you have embryos or you have frozen eggs or something like that, but you can't ovulate if you don't have ovaries.
Yeah.
Right. Okay, so there are treatment options, right? And we've also made a video on more like natural kind of options as well. So some combination might be the thing.
Yeah. Oh, and there's a medication that's under trial right now in I think the UK for PMDD, but not in the US yet. But that one has some pretty promising results.
See? Okay, maybe we can do an update on this video in the future.
Yeah.
Cool. Thanks for being here today. Please like, comment, subscribe. We'll see you soon.
Bye.